So basically, I'm asked to talk about some of the practice of telemedicine in China, which seems to be a kind of quite hot topic, because uh, the COVID-19 epidemics. So I'm mainly okay. This is my disclosure. So I'm going to just talk about some of the challenges for Parkinson management, particularly in China, and also talk about some of the things that we have been doing regarding to telemedicine, and also talk a little bit about what the future development that we're foreseeing or we are trying to develop. So Parkinson disease is quite common among the elderly. Particularly the prevalence of Parkinson disease is quite high in China. Um, I think it's mainly because of the large number of people. So from this picture that, let me just see here. So you can see this is China as comparing to other countries. The absolute number is quite dramatic in China. Right now, I think there are around 3 million patients of Parkinson disease in China, which accounts about 50% of the total world Parkinson population. So the number is expected to grow much faster. In 2030, it is estimated that about 57% of the Parkinson population will be in China. That accounts about 5 million patients. So it also has showing that the growth of the number of patients and also the burden, including the death rate, is quite dramatically, the speed is quite dramatically in China as comparing to the average global rates or even the more developed countries. So certainly, this gives us a quite challenge to the neurologists or geriatricians in China. And there are some problems in China because the medical system is somehow different from the Western countries, but also I think different from Hong Kong. One of the major problems is the uneven distribution of the resources, particularly the doctors or the movement disorder specialists. From this picture, the map here, you can see most of the neurologists specialized in movement disorder are localized in big cities like Beijing, Shanghai, Guangdong, or even in Sichuan.